So crystal ball, what's coming? What is coming?
Ooh,
And
yeah.
where's community independent pharmacy going? Where's vaccinations going?
So what you guys were just describing is, understanding that, community pharmacy found the time to take care of a whole bunch of patients whenever we were needed the most. So the lights were bright, the stakes were high, the environment we were operating was less than ideal with a vaccine or vaccines that had really difficult storage and handling.
Yep.
We stepped up, and that's why to me, we just have to continue to bang that drum that community pharmacy is a healthcare destination. What more proof do you need than what we've done in the past with flu shots, some adult vaccinations, but my goodness, 302 plus million COVID vaccinations when other healthcare providers didn't even have their doors open. Not only were we open,
Right.
not only did we remain to be community pharmacies and everything that goes along with that, making sure people continue to get their medications. We weren't vaccine spots that happened to be community pharmacies. We were community pharmacies that picked up the ball and ran with it. And yet there's still this, not confusion, but maybe lack of understanding that we are the logical place to expand clinical services. Whether that's scope, whether that's policy, whether that's payment. I think we're starting to turn the corner. We have to continue to prove ourselves.
So you're up in Washington. What are you talking about?
So, what we were talking about there was more on the public health side, but I never miss an opportunity to talk about community pharmacy. And in where there aren't as many COVID vaccinations right now for community pharmacy, there is an appetite to continue to do good by our patients. And that, again, will help our bottom lines, our relevance, so we're built to last, et cetera. So when you start talking about patient communication and engagement, so wouldn't it be cool, and I know you guys do this, but not only are you taking an opportunity based on somebody's age and what medication they have to see if they're due for their shingle shot, but if you can inform that communication more precisely and knowing that even though they didn't get that vaccination at that pharmacy, it was given somewhere else,
the doctor's office,
reported at the IAS.
Right.
Therefore, you just decrease the number of outbound messages you have to pay for.
Yep.
You saved a little face with your patient or an inbound phone call that
Yep.
would come in saying, wait a second, do I really need a third shingle shot? I just got it last, so, but there's also the ability for us to curate the information that's in the IAS to then serve it up on a T to show you where the gaps are. So as a pharmacist that maybe is or isn't motivated to do more vaccinations, the last thing you want to do is serve something on a T for them to go talk to Mrs. Smith and she provide a negative feedback that I already got that, you knucklehead.
Yeah.
Right.
You don't want to demotivate
Right.
your pharmacist further. So